Roll.
Okay, for this portion of the assessment, we're going to do lungs and thoracic. Have my mom here with me again. Going to be doing the anterior side of her chest first, noting symmetry, the rate and depth of her respirations, noting any kind of pectus excavatum, which is the sunken end of the chest, or pectus carnatum, which is the protrusion of the sternum. Alright, she doesn't have any of that noted. Next, we're going to palpate. We're palpate for any masses. So I'm just going to use my hand. Going down. Okay, going to do the other side. Okay. After palpating that, we're going to auscultate. I'm sorry. Okay. We're listening for lung sounds. We're going to probably note that most of hers will be vesicular because she is in good health. But if we are to note any adventitious breath sounds, then we will note those. Take a deep breath wherever my stethoscope goes. Okay. After auscultating, we're going to percuss. We're listening for any resonance in her chest. So, up at the clavicle, you're going to hear a flat sound. On the heart or the liver, you're going to notice dull sounds. Nothing was noted with that, no abnormalities. Okay, next I'm going to have her turn around. We're going to do the posterior side. Okay, spin her around. Okay, we're going to do the same thing that we did for the anterior that we're going to do for the posterior. We're going to inspect her back. We're going to note symmetry, depth and rate of respirations. Another thing you can do is put your hands at the lower part of her back and have her breathe in, breathe out. Note an equal chest rise. Next, we're going to look for any scoliosis while we have her turn around, any kind of S shape in her spine, or any kyphosis in her back, which is curvature or roundedness in her back, like a humpback. We're going to note the rate and depth, again, in her breathing, her respirations. We're going to palpate, just like we did on the anterior side. Palpate for any masses. Okay, and the other side. Okay. After palpating, we are going to auscultate. We're listening for any adventitious breath sounds again, like crackles, wheezes. Crackles sound like a popping noise. Wheezes sound a result of airway obstruction and kind of have a musical sound to them. Auscultate now. Deep breaths. everything sounds clear. No adventitious breath sounds were noted. And next we're going to percuss, just like we did on the anterior side. No abnormal noted findings were noted there. And that concludes the abdominal portion, the thoracic portion of this assessment.